This is Gabriel Meissner, and you're watching RPTV News. Healing Our Inner Child. Indigenous Health Gathering at Moss Park addresses intergenerational trauma and cultural renewal. Toronto's downtown east continues to be a place where Indigenous culture, healing, and community care come together. Hosted on July 23rd by the Toronto Council Fire Native Cultural Centre, the 2025 Indigenous Health Gathering took place at the Spaces building in Moss Park, 339 Queen Street East, inviting the community into a space of warmth, ceremony, and connection. Guided by the theme, Healing Our Inner Child, the day offered a chance to reflect, restore, and share. The Red Bear Singers, a group of residential school survivors, opened the ceremony with traditional songs and drum rhythms. Health and wellness tables surrounded the room, led by groups such as Indigenous Health Program, Toronto Public Health, Shkaabe Makwa, Two-Spirited People of the First Nations, and others, sharing tools of knowledge rooted in Indigenous-led care. RPTV journalist Thundercloud spoke with First Nations community members and Indigenous health advocates at the tables, learning about the services available and the need of our urban Indigenous population. Now let's join Thundercloud at the gathering.
Hello, Ani. Bonjour, I'm Thundercloud for Regent Park TV. Welcome to the Toronto Native Council Fire's Health Gathering in Toronto, happening annually, and here I am. We're planning to cover many amazing health services, counseling for Indigenous peoples in Toronto. Elders were present opening, and the Red Bear Singers were opening. They sing and drum, and they are also survivors as well, and they're going forward with their healing, and we're very proud to have them here in the spaces at the gathering today. Miigwech.
My name is Roberta Pike. I'm the Director of Indigenous Wellness, Reconciliation and Partnerships at Unity Health Toronto. And our hospital network is basically 3 hospitals and all the various sites at St. Michael's, St. Joseph's Health Centre on the Queensway, and Providence Healthcare. And so we offer a range of services all the way from the emergency department to the inpatient units to rehab and long-term care. Everything in between, all sorts of outpatient clinics and family health teams. I run the Indigenous Wellness Program at Unity Health across all of our sites, and we have a bunch of specialists that will go and meet with patients wherever they are in their healthcare journey, and we'll be there to advocate for them, to assist them in their care needs and also their discharge plan back to community.
Wow, that's incredible. That's a lot of responsibility. I'm really proud of you.
Thank you.
So what happens at an event like this health gathering? What does it do for the people in the community here?
I think it provides a really great opportunity for them to reach out and find out what services are exactly available in the community. And it also is just wonderful for them to see the faces of people that they're going to encounter throughout their healthcare journey. The other thing that's kind of unique and lovely about this is that us as providers get to meet all the other people that are offering services, and we have an opportunity to be able to network and to be able to draw upon all community strengths for the good of our community members.
Who are you?
Who am I?
Who is this wonderful woman?
Well, I'm Inuk. My family comes from Cambridge Bay, Nunavut. I was born in Williams Lake, BC, so I kind of say I fell from the northern lights, crashed into the treetops. Now I'm in Toronto. I work for the only Inuit Foundation in Toronto. So I do external relations. We do a lot of programming for elders, Inuit children. I do more on violence against women.
Wonderful. I'm a counselor advocate for assaulted women and children as well. And what's the name of your organization, or is it a charity or a initiative? What is it?
So it's Tung Singuvat Inuit. It started in 1987 in Ottawa. So they have a huge headquarters out there. We just started in 2023, so we're fairly new. There was only 2 or 3 people running the programs, and now there's 7 of us. So yeah, every Mondays and Thursdays we have cultural foods, food bank, and we bring anybody, nurses, dentists, whatever they need. We just gave away ACs for the summer, right?
What's your specific job? Do you have a position, or what do you do?
Ooh, I'm doing administrative duties. Like next Tuesday, I meet with Indigenous Women's Advisory Council, talking about violence against Inuit women and the programming between Ottawa and Toronto, and how can we do it here for our people. So yeah, and then I'll be meeting in Indian Affairs as well. So
That's wonderful, and it's really important work. And it's we're so honored and you're so valued to be here, that you do your outreach for your people, and I'm sure a few others slip in there. But it sounds like an amazing, so beneficial and needed. I'm not sure if it's an initiative or service,
right?
basically.
It's kind of both. I have a community now. I never grew up with any Inuit around me. I was 19 when I first met my aunt, and I came to Toronto in 2007, and now I have a community, people that look like me, so I feel like I fit in finally, and I can help others that can fit in, and do good. Like, become a bright light,
You are the bright light. And I know that this woman is a bright light. And we're so proud of her to have her working and residing in Toronto. Aww.
Well, my name is Nicole Levesque, and my spirit name is Circling Hawk Woman. I'm from the Eagle Clan. Yeah.
That's wonderful. So what I'd like to know is, what are you doing here at the Two-Spirited table at the health fair today?
Yeah, we're sharing lots of information about our crisis team and some of the our core side, because there's 2 sides of Two Spirits. There is our crisis response service that's with the City of Toronto, that's gone citywide. So it's like a non-police response to any community member who's in crisis. We also have a crisis number that they can call to talk to somebody if they don't want somebody coming to the house or to their home or wherever they're at. They can call us and talk to somebody right away. We also have other services too.
As I understand, you can call 211. And this is what I understand now. You simply call 211 and you can get through to the crisis line.
Yes.
Is that correct?
Yep.
And Two Spirits has instrumented that in the past few years, is it?
I think it's just over a year. I could be wrong with the dates, but it has been well over a year. And at first, it was just a district, and then we would respond to community members, outside of it. Now it's citywide, and we have 3 teams that go. So there's the core, like downtown core, then we have the West End and the East End, so that we're the whole GTA for our community.
Yeah, well, that's what I understood, that it was the whole GTA, and it wasn't before. I'm so impressed how it's grown and how, all this is included in the medicine wheel of Two Spirits. And what else do we do at Two Spirits? Since I'm Two-Spirited, everybody, hello, and I'm a they.
Well, my role is, and then I'll speak to my role, and then of course other roles that we have. We have a partnership with Surrey Place Centre, and so I coordinate services for families that have children with autism or complex special needs, meaning any diagnosis to Down syndrome, to any type intellectual disabilities, any diagnosis like that where they might need support with accessing resources, accessing funding for their families. Also, the Ontario Autism Program's Urgent Response Service, I'm a service coordinator for that.
That's wonderful. I'm impressed. And I'm proud of you, too. Do you want to tell us a little bit about what Two-Spirit means to you?
Well, for me, I'm not Two-Spirited myself. I identify as queer, but I know I grew up in teaching, so I was raised with my grandmother, and my grandma, she didn't have the term Two-Spirit yet, because that name wasn't birthed yet through that ceremony, but she talked to me about those who are all genders and are fluid within it. And she said that those are our medicine people. So I remember when I was quite younger, she saw, it was one of the first, like Boy George had come out in Culture Club. And I didn't know what that was, that my nan liked that group. She liked country music. But she didn't know that they were a musical group. She just saw that there was actually somebody who could kind of blur that gender line and be fluid within that gender. And so for her, it was, those are our medicine people coming back. And she kind of gave me those teachings. I was quite young. So that's my kind of knowing and growing up in that way. And I'm also a parent of a Two-Spirited individual. Indiana is my child. So I am honored to be a parent of one of our Two-Spirited community members. Yes.
That is so lovely. Can you tell me a bit about the Indigenous Health Program?
Yeah. So I'll introduce myself first. So Ani Bojo, Nabawet Genuzit Shokakwe, Jishnakas. My government name is Victoria Mantwabi. And I'm an Anishinaabe Kwe from Okumukan Unceded Territory. And I'm the Indigenous Patient Navigator for the Indigenous Health Program at UHN. So I support community when they're coming into the hospitals, and I will support them at Toronto General, Toronto Western, and Princess Margaret. And I'm support them as they're inpatient to coming up for an appointment, and I support them on their care. We call it a medicine wheel model of care, so we just don't look at the physical part when someone's coming into hospital. We look at their emotional supports too, their mental support and spiritual support. At UHN, I've been in this role probably for a couple of months, but before coming in here, I was the emergency department navigator. We have one, Olivia, who's the emergency department at Toronto Western. We have Odette, who's our community health worker, and what she does is she'll support community outside of the hospital. So when they come in, I will see if they need any supports for, if they're coming in like on house, if they're coming in with any mental health support, substance support, we'll connect them with Odette, and Odette could support them outside the hospital. I can't leave hospital grounds, so I'm always inside. I'll let you introduce yourself.
My name is Ani Bojo. Mashkiki Maigan Kwe Dodam Maigan. My name is Serafina Shirt. I'm from Saddle Lake Cree Nation. I was born and raised here in Toronto. I am the program coordinator here at UHN with the Indigenous Health Program. Another important, our grounding principles are based off the 7 grandfather teachings. And in my role, I support the coordination of the program, the administrative needs, or any other form of support. Yeah.
Wache in Cree. And what a beautiful language and rich culture. I hope that you'll share a little with us here. And we have a helper here who takes care of the community and helps in the community and has beautiful medicines on the table here that are very important in the Native way. and let's hear a little bit about helping with medicines and
All right.
what you're offering today.
Wache. So, kapatweta nishnakasuyan, nesta Stephanie. So, my name is the first sound of Thunder Coming. My English name is Stephanie Moses.
Last door prize. It's beautiful.
My home is Moose Cree First Nation, Moose Factory Island on the shoreline of James Bay. So my family come from both sides of the James Bay coastline. I reside here in Toronto, and I'm currently offered to help out at the health fair here, giving cedar foot baths. So cedar is one of our medicines, and it's one of the roles and responsibilities, a teaching that I've been responsible for carrying, along with other, ceremonies and such that I also help with. And, I'm giving the cedar foot baths to the community members today to offer them as a space for their own wellness and their own well-being. So everybody will kind of have a different kind of experience with the cedar foot bath. It all depends on their own energy and what kind of medicine that it's going to give them. So it is an incredible healing activity, something to do. You can do this in your own home. It's a matter of, going out onto the land, finding, the natural trees out on the bush, and, you offer your sema, you just stem out your tobacco when you're, ready to pick your cedar, and you let that tree know why you're going to be taking that medicine and what you're going to be doing with it, and then you can prepare your cedar tea. So, you pick your cedar, and then you take it home and you wash it, rinse it out, and then you can boil it. So, all you need is, just really, about that much for yourself. You can put it in a pot, you can boil it, and then it comes out like this.
That's medicine.
Yeah.
Yeah, good medicine.
And then you put that in a little bin, and then, with some warm water, add some warm water to it, and let your feet sit in it.
I will do that for sure. Or if I have time, I might ask you to help me out with that.
For sure.
That's wonderful. Now, may I pick this up? Now, I know cedar is a good filtration, like it helps pollution as well as one of our medicines.
Smell it, right?
Yeah, and it's just so fragrant.
So it's very grounding. Yeah.
I just feel like I'm in the forest.
When you drink it as a tea, you don't boil it as long as you would for cedar foot baths. You boil it a little bit lesser time, and you can drink it, and it has medicinal properties as well, especially when you have like colds or you have like upper respiratory. Yeah.
How long do you suggest to boil for a tea?
I say maybe 5 minutes, not long at all. You don't need to. Yeah.
Sometimes I do cedar infusions, but I know I've been told it's a bit long, but I make that tough old city medicine. I'm kidding.
Put some honey in there. You can put some maple syrup in there if you like. Yeah.
Sweeten that cedar up.
I've seen people put berries in there and make like a cedar berry medley.
Can you also show us the other medicines? How many medicines do you know we have?
Well, so I use many. I mean, our forests and our lands are our own pharmacy. So there's so many out there. So, I mean, our 4 sacred medicines are tobacco. Right? Tobacco. Do
you want to tell us what that is in your hand?
So this is just loose tobacco. So in here is it's a little square, and it's called a tobacco pouch. It's like a tobacco offering. It's in a cloth, and you can use this to pray with. You can use this to gift to someone if you're asking for a teaching or if you're asking for help for something. This is our
Is that called protocol as well?
So,
sometimes?
Yeah. It's part of our protocol. It's part of our way of when you're asking for something. It's your way of, presenting that to your elder, your knowledge keeper, your friend, or your helper. Anybody even when you go to the land, right?
You're a wealth of knowledge and a great helper. Pleasure to meet you.
Thank you. Miigwech.
Okay, miigwech.
A central teaching of the day came from Vivian Reclet, an Anishinaabe grandmother whose spirit name is Bidashon Hue, who shared reflections on healing our inner child, focusing on cultural reconnection, intergenerational trauma, and the importance of embracing Indigenous ways of knowing in mental, emotional, and spiritual healing. Let's take a moment to hear part of that reflection.
Vivian has given so much to community, and she's here to share a little bit about healing our inner child. And thank you so much, Vivian, for being here.
It takes a lot of commitment for our Anishinaabe people to be able to pick up the pieces of what has been done to us from the legacy of the residential schools and all of that stuff, the trauma, the pain, the hurts, all of those things that we've gone through. And some of that work that we do is so critically important to really discover our own spiritual essence as Anishinaabe people. We're not the savages, the drunks, all of those things that we've been stereotyped with. Those are just things that were used to impact on how we walked upon Mother Earth, distorting our viewpoint of who we truly are. And I really, really emphasize that because the impact of colonization took away from us. We need to empower ourselves now to be able to gather ourselves so we can find our own beautiful path that our ancestors walked. The fights that they went through to be able to, for us to be here today in this space and time. So she introduced me as Vivian Reclet. I'm originally from Makwa First Nation of the Three Fires Confederacy. I grew up on the reserve. A lot of people don't get the opportunity to grow up on the reserve because of that family discord that happens when we've been taken away into the 60 scoops and stuff like that. I was part of the 60 scoop, a part of the Indian Day School. My parents went to residential school. So I have that legacy of pain and trauma through the bloodline to have to deal with in my lifetime to figure out who is Vivian. When I was covered up with all that pain and trauma perpetrated on me by adults that were supposed to be kind and loving to me and providing safety and nurturance to me, I didn't know who I was besides all that pain, carrying all that pain. And when we talk about that inner child work, this is a phenomenon that happened in the 1990s when, the Aboriginal Healing Foundation came to the understanding that our people need to have supports and services that will help us as Anishinaabe people to heal from those generational things that we were experiencing. So many of the things that we've had here in Toronto to help our Indigenous populations come to a better understanding of how to heal together as a community. We're all displaced from different nations. We're all here to try to find a better way of life and to help our families to heal from those legacies that were left to us by colonization. A lot of times I think about my mom and my dad who were in residential school and what happened to them with all of the abuses that they suffered as little children. Little children. And this was supposed to be civilization, they said. To civilize the Indian, to take the Indian out of the child. Well, that's a really bold statement made on the pretext of protecting us from our own families. All of those horrible things that they went through. And all the horrible things all of us in this room have gone through in the pursuit of growing up. Growing up to take our place in society, to better ourselves and everything. But we had so much obstacles and barriers to contend with. The Western society psychotherapy departments have named, the inner child work as part of their own discoveries, as they often do. They discovered the inner child work. We've had that since the beginning of time as Anishinaabe people, where the child was the center of our universe. They were the most respected, highly attended to child with special gifts that they came to us. I grew up in a very, very traumatic time where they didn't even have the supports and services to heal what happened to them. And a lot of our people didn't. They didn't even have each other because of those barriers and obstacles and being told what to do, how to walk, how to say things, how to dress, how to not speak our language. The language is the center of who we are as Anishinaabe people. And I think, you know, for myself, I'm so fortunate that I can speak majority of my language. I'm not a full language speaker. I don't read or write it, so don't ask me to write it. No. I was laughing at an elder one time, and he was listening to two people arguing about how to spell miigwech. And then he says, wow. They looked at him and they said, well, you're the elder, how do we spell it? He said, you guys are both wrong. And then they said, what? We never wrote our language. So, you know, those kind of things do happen, and we never really think about it because we've been so caught up with following civilization as we know it, and have become a part of the general herding of the people to do certain things, to be at certain places, all of that. Even working 9 to 5, getting up, showering, go to work, all of that stuff. Long time ago, when I was little, I grew up in Wiki, and we never feared, we were never afraid. We could walk into people's home, and they would have a big pot of soup on the stove for anybody to help themselves. They would have apples and oranges for us kids if we were hungry. But you can't even walk into anybody's home now. Everybody's locked up because of all the things that have happened and how we've been estranged from our own kindness and love. The love that was once in our hearts is gone. And the kindness we once generated as Anishinaabe people, because that's who we are. And we still get in trouble because we still have a kind heart, a loving heart, and that open mind and that open space. But if you look around the room here, we have a lot of beautiful people that have been through a lot of things. You know, our oral tradition is one that's passed down to us, and it was severed. It was broken so that we didn't get the opportunity to learn. But there's a resurgence, just like that inner child resurgence of understanding that all of us had our little inner child hurt and broken and de-spirited by civilization, as they call it. Take that pain away and talk about it. Or go to a sweat. Go out on the land and offer your sema. Sing those songs with those beautiful drums. And go to people that can help you. We have lots of groups out there. Council Fire has the residential school group. And I'm really, really incredibly indebted to the work that they do.
I just want to say Miigwech for everyone who came to the Toronto Council Fire Native Cultural Center's health gathering. It was a very expansive event. It's annual. It grows bigger every year. It covers more health for Indigenous peoples. And I really hope that you can come to Spaces, that's the location, and come and experience this health fair next year, because it was wonderful. Thank you from Regent Park TV. Miigwech.
Don't forget to like, share, subscribe to our YouTube channel, and visit us on all our social media platforms. Please visit our website for more information.